Hello, this is Dr. Robert Bouvier with Doctor and You, and this video is specifically for the businessman or woman out there wondering what is healthcare benefit, how can I have a good healthcare benefit, what does the Accountable Care Act do, how do I really have this wonderful medical benefit that was supposed to be wonderful and now it's turned into kind of a ugly demon of some sort, but it really doesn't have to be. This is a wonderful time for businesses to actually take charge of their health care benefit they're offering their employees and really tailor it to what their needs are. Let me give you an example of that. But first, I'm going to show you the website, Doctor and You, www.doctorandyou. There's a spot here, a button for businesses. Just click on that and you can kind of navigate through some of the questions and review with this video. This video is to primarily bring you up to date on how the Doctor and You concept all evolved with businesses. I've taken care of a lot of businesses and we've gone on site and done a lot of their wellness and taken care of a lot of their executives, done executive physicals for years. And when the Accountable Care Act came around, the businesses were just kind of struggling to find out, well, how do I take this, what was supposed to be a medical benefit, and keep really good employees and keep them happy and healthy, but it's kind of turned into a monster. So how as a business person do you offer this great benefit at the same time not break the bank? How do you afford all this but still keep good employees with this wonderful medical benefit? Last month we had a patient, actually it was last quarter, patient came to me, local business guy, has about 150 employees. 15 of them are executives. 5 of those executives actually travel across the United States, and a few of them go abroad every year to take care of clients over abroad, and they want something to secure that presence, to take care of them not only here locally but also when they travel both local and abroad. But they also wanted to have a good preventative wellness plan for their employees that stay here locally. So we went ahead and looked at their health care plan. Their average spending was about $1,700 to $1,800 per family per month for their health care benefit. It had gone from $1,200, which was already too high, and it expanded up to $1,700 now with the Accountable Care Act. It came to me and said, how do I create a benefit without breaking the bank? So we looked at what they were doing, what they were offering. We interviewed their employees. We found out the employees wanted a few things. They wanted 24-hour access to a personal on-call physician. They wanted a very private medical record. This was probably the number one thing they wanted, was a very private medical record. They wanted same-day on-demand consultation, x-ray lab services and wellness. They wanted on-site visits. They wanted no waiting, as much time with the doctor as they needed, complex disease management, and also expanded wellness and integrative medicine. Not just the employees, but actually the owner, and he wanted this for his family. So we were able to reduce their overall premium dollar that they did. We got them a catastrophic plan that took care of $10,000 and above, and that cost them about $400 on the average of a family of 5, about $400 per month. We took another $500 per month, put it into their health savings account, put another couple $100 a month into a flexible spending account that they were able to spend on various things. In fact, many of the things that were not paid for by their insurance company are now paid for by this flexible spending account. In addition to that, they offered on-site wellness, and we've got a nurse going over there now every day. So we were really able to probably quadruple the benefit, but really reduce the cost by about half. We've had a couple instances where people got sick overseas, one in Mexico, one in Singapore. They were able to get on Skype with me. We have this medical kit that it's really an emergency medical kit that they travel with, and we were able to take medications and documentation from this medical kit, and we were able to take care of them on the fly. They could still continue taking care of business there, but had their medical problem taken care of. Instant access to the medical doctor, and these problems were taken care of. In one instance in Singapore, the actual patient has an irregular heartbeat. We were able to take the medical kit that they traveled with, put the put the iPhone against their chest, and I was able to look at an EKG, look at their heart rhythm right through Skype, and tell them that they were just having an irregular, it wasn't the bad atrial fibrillation that they had had before. We were able to diagnose that on the fly, real time, 24/7, and they were very appreciative. It's worked out very well, and this is just an example of what we can do with telemedicine and mobile health. So there's wonderful technology out there. As a businessman, this is really your opportunity to offer a better benefit for your employees. Give us a call. We can travel to different areas. We're not just located in Michigan. We can travel to different areas and help you take care of a very important part of your practice. Again, this is Dr. Robert Bouvier. If you're looking to lower your premium costs, improve your benefit package to your employees, create executive physicals and things like that for some of your valued employees, then give us a call. Again, this is Dr. Robert Bouvier with Doctor and You. You can call us directly at 810-610-7972, 810-610-7972, or go to the website, Dr. D-R-A-N-D-Y-O-U, push on businesses, and learn a little bit more about what we do and how we can help you. Thank you very much.